Hi everyone, Dr. Suneel Dhand, internal medicine physician. Welcome to another video. I would like to talk about a medication, an injection, which is given to most hospitalized patients in the United States. And I believe this is also the case in the United Kingdom. And I believe a large number of these patients may not even require this injection. The injection I'm talking about is heparin. Many of you may be familiar with this in either yourself or a loved one. And it can either be given alone as heparin, either 2 or 3 times daily. Don't get me going on that because there is a lot of evidence that twice daily is as good as 3 times daily. So it's always good to have any medication or therapeutic in the least dose possible. It can also be given as a longer acting form. The most commonly used version in the United States is enoxaparin, also known as Lovenox. Again, many of you may be familiar with this. And the heparin industry is massive business. Estimates suggest that the current market size is $1.3 billion, projected to increase to $1.8 billion by the end of the decade. And we all know how the world of healthcare and medicine really works. No surprises there. With a lot of things, there is a big money exchange going on at some level. So why do we administer this medication? Well, I'm not saying it's never indicated. In many circumstances, it is indicated. And the theory behind it is that heparin, Lovenox, whatever you're administering, lowers the risk of DVTs, deep vein thrombosis, blood clots, or blood clots forming and then going up to the lungs. And there are certain indications for this. For instance, if you know if someone is going to be immobile for a long time, if you know someone is going through surgery, especially orthopedic surgery, and we also use it to treat many conditions, including blood clots themselves. So it is indicated in lots of circumstances. My issue is when we use it for prophylaxis in someone who is not particularly high risk. And this is an example of what I call tick box medicine, mindlessly following protocols, because there are a ton of people all over the country who are younger, who are able to walk around, who aren't completely bedridden, who have heparin administered to them, who may not need it. And think about this. If somebody is sick for a couple of days, say at home, and they're in their room, they're confined mainly to their room, they're not walking around very much, there's no indication to give them an injection of heparin just because they happen to have an illness when they can otherwise walk around. The doctor doesn't just say, oh, I'm going to order some heparin to come to your house. So likewise, in the hospital, if someone is younger and able to ambulate, walk around, sit in the chair, walk around their room, there is little indication for giving heparin prophylactically. And personally, if I was ever in the hospital, assuming I wasn't bedridden for a long time or having a specific type of surgery like orthopedic surgery, say I was admitted with a relatively mild condition and I could walk around, I would absolutely refuse the heparin. Why would you give me this additional injection when I'm not bedridden and I can walk around? And again, this happens because we live in the era of tick box medicine, mindlessly following protocols. Oh, patient admitted to hospital. We therefore have to give heparin. And there are currently probably thousands of patients all over the country who are having this injection given to them when they are lower risk and don't particularly need it. So what would be the problem with giving heparin, enoxaparin, Lovenox to someone who doesn't need it? Well, my first principle is always you shouldn't administer any therapeutic to someone who doesn't need it. So that's the first reason why. But aside from that, these medications are not completely harmless. Firstly, they're quite painful. When people have an injection into their abdomen, usually, it's not particularly pleasant. It's a pinch, a second or two of pain and discomfort. And more important than that, I can tell you that I have seen so often patients get administered heparin in the hospital and they end up with abdominal bruising. They may have a large expanding bruise. Maybe it even develops into a hematoma. Now, I'm not saying this happens all the time, but it happens enough to be noticed. And often the patient is low risk in the first place. Why did we subject them to that? Just because we are mindlessly ticking boxes and saying if somebody is admitted to the hospital, they must have heparin. That's absolutely ludicrous. So the point of this video is that I believe there are thousands of patients admitted to the hospital who receive heparin who don't need it. What they should be doing is getting out of bed to the chair, walking around. They're perfectly able to do that. They're not particularly high risk for getting a blood clot just because they're sick for a day or two. And think about this, often patients will only come into hospital for 24 hours, and the protocol will say administer heparin the very next morning. If there's no particular reason to do that, they're not high risk, why are we doing that? Why are we allowing pharmaceutical companies to make money, not without added risk, by the way, just because we are ticking boxes? We need to get back to more common sense in medicine. Everything should be much more minimal. We only administer therapeutics, whether it's a medication or an injection, when we absolutely need to. So in conclusion then, I would like you to remember for yourself or a loved one, if you get admitted to the hospital and you're perfectly capable of getting out of bed to the chair, walking around, many patients walk around the floor up and down and they're still on heparin and they're low risk for blood clots. So clarify with your doctor on admission. What is the reason for giving heparin if you can walk around? And once more, I would like to say that there are certain reasons why we do want to administer this medication in higher risk patients, including those who are bedbound, those having surgery, especially orthopedic surgeries, but there are many who do not need it. Thanks everyone for watching. Feel free to comment down below. Let me know your thoughts. Do you have any experiences with heparin, whether positive or negative? Let me know. It's always good to hear from you. Take care, everyone. Stay strong. Check out my Health Academy and my free newsletters. Those links are in the description down below. Hit the like button if you like this video and the bell button for more similar videos in the future. We will speak again next time.